Hello Australia, welcome to another very special Couch Extra. Today, Frank Prokop is back with a very special guest, Dr Nathan Gibson, talking about mental health. Over to you, Frank.
Thank you, Fred. One of the things that affects us all, either directly or indirectly, is mental health. It's something that we as Australians don't necessarily treat very well, and it's something we don't talk about very well. I'm extraordinarily honoured today to have Dr Nathan Gibson, who's the Chief Psychiatrist here in Western Australia. Welcome to the couch, Nathan.
Thanks, Frank.
One of the very first questions that people often ask is they're confused about the difference between psychiatry and psychology. Can you just give us a quick understanding of the differences?
Sure. Both are health professionals, regulated health professionals. A psychiatrist is a doctor who goes on to do 5 years of training in mental health in psychiatry and who can prescribe medication as well as do the talk therapy and is an expert in mental illness. Psychologists start with a psychology or equivalent degree and they really focus on the talk therapy. They don't necessarily prescribe medications. Some of them go on to do masterates, doctorates, and clinical psychologists actually go on to do special training around severe mental illness. But they are the talk therapy specialists.
And they all work, they can work together. They're not necessarily adversarial. The people will prescribe specialist care depending on what your needs are. And if you are looking for getting some information, where might you go to discuss your mental health and other issues?
That's a very good question. I think the best place is to start really within primary care with your GP, because whilst most mental health occurs in the community, not in hospitals, GPs are the best starting point. They are useful at screening for mental illness, and they can also provide appropriate direction as to where you might get further care.
And they do have a 10-question survey that can help to identify if you can go on, and they can give you access to a psychologist, for example, if you're feeling stressed, or they can prescribe psychiatric help if you need it as well.
That's right. In this day and age, there is a process where you can actually get referred to a psychologist for talk therapy by your GP. You don't have to go and see a specialist for that.
And it can be covered under Medicare as well.
That's right.
One of the biggest challenges about mental health is the stigma associated with it. Many people are very concerned that if they admit that they're suffering from some difficulties, and they can be transient, as you well know, that they'll carry for the rest of their life this stigma that they're somehow unstable. What can you give us about what the prognosis might be for someone who's undergoing a few troubles at any one point in time?
It's a really good point. Stigma is such a huge issue. It's the biggest barrier to getting appropriate treatment for mental health issues in the world today. And what I would say is that the vast majority of people with mental illness, the vast majority, never have to go to hospital. They can get really top-class care in the community, and in most cases, most people can get on with their lives and they can get back to work, on with their relationships. So the idea that mental health is a sentence, or mental illness is a sentence, is not the reality for most people.
And I understand that now we're seeing some recent trends that, for example, men who've long been regarded as ignoring our mental health are starting to change their behaviours.
Yes, I mean there's recent research which suggests that whereas we used to think men wouldn't go and visit their GP, men are going to visit their GP these days, which gives a great opportunity for GPs and men to screen for mental health issues.
So we've covered one of the stigmas, social stigmas about mental health. If you've got a friend who you think is suffering a little bit, one of the biggest challenges still is how do we go about engaging with them as a friend in a way that is non-threatening, that will encourage them to seek help or to be able to address those issues?
That's a great question. There's a couple of things to say. One is encouraging them to go to their GP is one aspect, but as an individual, listening to them, hearing what they have to say, taking them seriously. The fact that someone is talking about suicide, if, for example, if you ask someone whether they're thinking of harming themselves, it doesn't increase their risk of harming themselves, and they may feel like someone actually is asking the right questions for a start. I could perhaps suggest that there is a program developed in Australia called Mental Health First Aid, and any individual in the community can do it. Thousands of people in workplaces have done that now, and it provides a fantastic grounding for people to understand how to respond to someone who might be presenting to them with mental health issues. It doesn't make you a clinician, and you don't have to be a clinician, but it just gives you some of the ground rules and the basic skills to actually do that. So mental health first aid, that can be found on the web.
And we've also got some websites that you've recommended for people to check out if they'd like to find out more about mental health and mental well-being. What would those be?
Well, I think the SANE website is a good one. We've got a number of websites around, but SANE have done a lot to really reduce the stigma around psychosis. A lot of work has been done to reduce the stigma around depression and anxiety, but psychosis is another important and serious mental illness, and that's SANE, and also the Black Dog Institute, who provide a good link with research.
I think it's safe to say that many of us will feel depressed at certain stages in our lives, but that doesn't necessarily mean we're suffering from depression. It's important to recognise that we're all going to have bad days, but if they start to become habitual, then there are lots of things, and Dr Gibson's given us a lot of assistance in ways that we can go about helping to become more productive and addressing the problem to achieve a long-term outcome.
Yeah, I think that's right. I think depression is something that is ranges from having a bad day to a very serious illness. And if you're unsure about where you fit in that spectrum, you can speak to your GP.
Well, Fred, I think that there was something in that interview for each and every one of us. I hope that people will be able to address this difficult problem and move forward. Over to you, Fred.
Thank you, Frank. And identifying mental health is probably one of the hardest things, because so many people that you would call normal, like me and Frank and Dr Nathan, can suffer mental health, and it's the categorising, and I think we need to stop thinking that anybody with mental health issues must be insane or have an issue. It's a mental health problem. Many people suffer it. Go to the website that Dr Nathan suggested, but if you want more information, go to thecouch.com.au. We'll put up a link right here for everybody to be able to look up. Thank you to Frank, and thank you to Dr Nathan. We'll be back with more of The Couch on a Sunday night only on Foxtel, or keep an eye here on the website for more information soon.